Brooke Siem is a writer whose work on antidepressant withdrawal has appeared in the Washington Post, New York Post, Psychology Today, and more. Her debut memoir, May Cause Side Effects, is the first book on antidepressant withdrawal to hit the mass market, a notable milestone in the journey to bring global awareness to antidepressant withdrawal. She is also an award-winning chef and Food Network Chopped champion, and founder of the newsletter Happiness is a Skill. This interview took place May 9th, 2023. Brooke, good morning. Thank you so much for joining us here today.
Thanks for having me.
I have been thoroughly impressed with, scared by, and heartened by the book you wrote, May Cause Side Effects. And I'm hoping you can tell us about which aspects of that book you want to promote most.
I always struggle with this question because there really are 5 or 6 different kind of avenues and directions you can take from my book. And I want to talk about all of them all the time, and we never have enough time. But the main reason why I wrote May Cause Side Effects is because it is the first book that was bought by a traditional publisher and is being marketed towards the mass market, which is all very important on the subject of antidepressant withdrawal. And that is a topic that affects tens of millions of people, but they don't know. And we need to make sure people understand this, because there are so many people on antidepressants all around the world, and people need to know that getting off of them is not as simple as getting on them. And so for me, the book it's a memoir. It's a pure memoir. It tells the story of what happened when I was pulled off Effexor XR and Wellbutrin XL in a rash and not very smart way in 2016. And it goes into the year I spent in severe antidepressant withdrawal. I hope that when people read the book, whether or not it's a patient going through withdrawal or a family member of someone in withdrawal or clinicians especially, they read the book and they are better able to identify what antidepressant withdrawal looks like, as opposed to what usually happens, which is people confuse it for either the reemergence of, the depression or anxiety or whatever they were experiencing that led them to take these drugs in the first place. And in even worse case scenarios, people get labeled bipolar or schizophrenic or all whole sorts of other mental illnesses because their symptoms actually look like the criteria for those illnesses. So the hope of this book is that it, cuts down on misdiagnosis, that it actually helps people who want to get off these drugs get off of them safely so they can live the life that they want to, and keeps people from, being on drugs they never need to be on for an illness they don't have. And that's kind of the work I do.
Yeah, and as you say, so often when people are going through whatever the backlash or withdrawal or the flood of symptoms that happen when they stop taking the medications, some of those people who are not as well educated about this topic think, oh, this is a recurrence of the symptoms that say you need the medication. This means you really are sick or crazy, or and that's rarely the case. The other point I wanted to make is that the book is such a powerful read because you're such a good writer.
Oh,
and,
thanks.
and that has, it's a blessing and a curse, because people might take it more as a novel or that you're just sensationalizing this. Whereas, because I have experience in the field, I know this is just a raw gut level explanation of the horrors of going through withdrawal in a very rough and, as you said, in not a very intelligent way.
Yeah, I appreciate you saying that. I mean, I am an artist and a writer at heart, so I worked for many years really massaging the language to make sure that it was getting the feel of the experience across in a powerful way, but also a compelling way, because, at the end of the day, storytelling is what changes. That's the movement. That's the story. People can get data and research thrown at them all day, but we're all kind of numbed out on that, or we think it doesn't apply to us. It really doesn't matter unless you're getting to the emotion of it. So that part was so important to me. And, it's an extremely accurate representation of what was happening. So, if it makes people uncomfortable, then I think they need to look at that within themselves, because this is what happened to me.
And, the wonderful writing had me, staying with it and wanting to, know where it goes. And so you're in that, page turning kind of a process, and it can be, easy to forget that the topic is so intense and so crucial for us, whereas you say many, many people are struggling with this, either staying on meds for years at a time and or getting off of them before, there's an appropriate evaluation and a way to, and you mentioned at the end of the book, the idea of hyperbolic tapering, which is something that, people like Peter Breggin, when he writes about, psychiatric drug withdrawal in his book, he talks about how there really isn't any prescription about how to come off of these unless you're deeply connected to the individual and their experience and their symptoms. And that's rare to find in a professional, in a medical doctor. I think you mentioned in the book that there aren't that many people who are well versed. You went to a psychiatrist who's supposed to be a specialist, and it's almost as though they take offense at the idea that you want to go off the meds, and rather than being really well versed in how to do that and getting to know you as a person, and then working with you at a plan for you. You had a horrible experience because you had pretty much the opposite. Somebody who was just going by a formula and basically, setting up the appointments and making sure you could pay for them. And then, it was kind of heartbreaking to read when you went to say, I really want to go off of the second medication. And basically you heard from the psychiatrist, a female nonetheless, good luck. Good luck with that. So. So
never saw her again.
Yeah. And can you tell us a little bit about what you've learned looking back on this, about how an intelligent, creative person like you could have been thrown into the situation or grown into the situation where the adults in your life thought you need, a whole bunch of medicines in you for the next 15 years? What was, what do you understand about that looking back on it?
The context here is really important because it adds another layer of complexity to my situation. And so for me, what happened is my father died suddenly when I was 15, and this was 2001. So we have to really think about the time and place there. Although I would it's not like this has gotten any better. So maybe the time and place doesn't matter. Bottom line is that my father died, and, I had a reaction to that, obviously, because who wouldn't? And, I wasn't actively suicidal. My grades hadn't absolutely plummeted. I wasn't hanging out with the wrong crowd or, suddenly got into street drugs. I was just stoic and in shock and lost. I mean, these are things that I think are completely normal reactions. And so I was taken to a child psychologist who called up my mother one day and said, you're wasting your money because what Brooke needs is a psychiatrist, not a psychologist. So I'm diagnosing an anxiety and depressive disorder and recommending medication. Here's the name of a child psychiatrist I recommend.
And you were 15 at the time.
I was 15, yeah. So, and not only that, we had a small family. It was my mom and me and my dad. And so losing my dad meant that my mom suddenly didn't have the other person who she would bounce ideas off of when it came to me. Furthermore, she was grieving herself. So, and she's not a doctor. So, what else is she going to do other than say, well, okay, we'll follow the expert's recommendations. And so I was taken to a child psychiatrist, and within 10 minutes, as you do, I had a couple scripts, and so I just started taking them. And, I wasn't in the position to question the adults or the experts around me. I mean, we've all grown up to listen to doctors and, go to the doctor and trust that whatever they say is truth. And so when the doctor told me, the psychiatrist told me that I had a chemical imbalance in my brain and, I was depressed and anxious and I was going to need to take these antidepressants, who was I to question that? Like, why wouldn't I believe that? And, on top of that, it validated what I was feeling because I was depressed, for God's sakes, because my dad had died 6 months before. I mean, this isn't a shocking revelation, but nobody likes feeling bad. Nobody likes feeling sad. And, for me, my entire trajectory had just fundamentally changed. So not only was I, grieving and sad and depressed and all these things about the actual physical loss of my father, but it completely reframed that was the moment when I realized that I wasn't going to live forever. And we all have that moment. It comes. It usually doesn't come when you're 15, but these are existential anxieties that are valid, that need to be worked through. So I certainly had a reason.
There's also the idea that it wasn't highlighted, but a little bit later in the book, I think you revealed that your parents had a family business.
Yeah.
When your dad died.
Mm-hmm.
So then it wasn't just you lost your partner. She also then had to do all this extra work with the business. And you also reveal through the book how your father really struggled with his anger. He had a real clear way to express his anger.
Yes, he did.
but not maybe so much fluency with the subtleties of other emotions. And you were very close to him, so you did the best you could, but you bottled a lot up. And then I seem to remember a situation with going to the doctor to need one stitch in your hand.
Mm-hmm.
And having all of these tears come out, and then your mom having to try to explain to the doctor, wait, her dad just died. And it's that kind of just the flow of life that if you don't have anything other than a bottle of or a list of prescriptions in your toolkit, you just give prescriptions. But there are so many other things that could be done with a 15-year-old who had a limited range of exposure to various emotions and lost her father that you didn't get the benefit of. And then because you were so intelligent and because you were so driven, you just kept churning through life with, describe for us what you were churning through it with. What was the impact of having all of those medicines in your system?
I mean, they certainly didn't really make me feel any less depressed, or I would say, like most people commentate, the lows are higher and the highs are lower, right? Like it took all the edges off, it numbed me out. So you have the impression of being better when in reality you're just numbing yourself through whatever's going on. I mean, I still, had the ability to focus on my SATs and graduating and going to college and all those things. But what it took away was curiosity and wonder and ambition. It just kind of made me this, slave to the expected, right? Like I needed to go to college and then get a job and then get an apartment and make money. And but I never had, because I was so kind of disconnected from myself, I never had the ability to turn inward and say, what do I actually want and what kind of life do I want to live? And I do think that on some level that's common for people of that age, but there should be a level of curiosity and experimentation happening at that time where you kind of figure out what you like and what you don't like. I never did that because I was always defaulting to the path of least resistance. Because from my perspective, I had been given this message at a very formidable age that I had a chemical imbalance in my brain, so I was kind of fundamentally always going to trend toward melancholy and be broken. So if that's the message you receive and that's the identity that you create, then there's no reason to be curious about the world, because it doesn't matter if you're, an artist or, a banker or an insurance agent, you're going to be depressed no matter what. So just do what's the easiest, what's the path of least resistance, which at the beginning doesn't really seem to be that consequential. But you start doing that for 5, 10, 15 years, like I was doing, you eventually get to a point where you're living a life that's so wrong for you that the depression just continues being your friend along the path, and you have a rationalization for it, so you have no reason to question it.
The other thing
When
that
in
you write
reality,
about,
maybe your life is wrong with you.
and the other thing that you write about so well is that your actual perceptions were changed dramatically. You were numbed down. You didn't see
My
colors,
sensory perceptions.
and you tolerated burns, from the bakery, and you didn't really see colors as well as you started to as you came off the medication. I think you wrote about it beautifully, and it's the kind of thing that you couldn't even understand until after you come off the medication.
No.
Because it was your norm. It was for 15 years, it was your norm.
Yeah, I mean, it's kind of like if someone, dripped just a little bit of like liquid cellophane on you every day for 15 years. Eventually, you're going to be covered in this layer of plastic, and you're not going to realize how you've been losing little bits of perception. I mean, literally, like when I started to get off the antidepressants, literally colors brightened. This is not a perception. This was literal, that colors got brighter, and my hearing became more sensitive, and clothing, and what I like to watch on TV, what I like to eat, it all changed. I mean, it was literally affecting every single aspect of my personality and my perception of the world, and I had no idea because it was so normal to me.
And as you say, when you started so early, it's such a formative period, 15, 16, 17. What do you see now, looking back on it, that you think allowed you to break free of it?
Of the antidepressants or the depression?
Of the antidepressants, of the routine.
Well, I had a bit of an extenuating circumstance because I had this opportunity to travel around the world for a year that dropped into my lap out of nowhere. And I kind of couldn't ignore that. It was such a big opportunity. And I realized that logistically I was going to have a lot of problems with the number of drugs I was on and actually getting them all around the world. And I couldn't source them from the places I was going because we weren't going to big cities. We were going to little towns and villages and islands. And so there wasn't going to be I couldn't, reliably get my Effexor in Europe where venlafaxine is banned. Like, it's not even legal there. So I said, I've got a problem. And so that was kind of the first reason why I said, okay, let me see if I can get off of these and discover my baseline. And like, maybe I need to be on something else. Maybe I wouldn't. I really didn't know, but I knew I had to at least address the situation in hand. And so then when I started to actually get off of the drugs, I was having such severe withdrawal, but I was also having these little moments of, when the colors changed and brightened, it was this kind of holy crap moment where I said, if these drugs were affecting the way I literally see color, what else did they affected? And so there was this, I was really angry because I felt like I had been robbed of beauty for 15 years because like color is wonderful, and to have not really seen that for 15 years, I just was deeply pissed off. Combine that with some world-class stubbornness. I just said, you know what? I'm not going to do this. Like, I'm going to ride out this withdrawal. I didn't know how long it was going to last at that point, but I just was so angry at the situation that I said, we're getting through this and I'm going to get off these drugs. And it was that anger and stubbornness that actually pushed me through the worst of it, because I knew that I couldn't go back. I couldn't like go from seeing color and then go back to everything being muted. I just couldn't do it. It made me too upset. I wanted to know who I was. My only frame of reference was when I was a child. My dad was alive. Like, I was so angry. I still am angry about that.
Well, and the other thing that you write about so powerfully is that even though you were on them before you started trying to get off of them, you were still very, very focused on ending your life
Mm-hmm.
and had a plan. And, so whatever benefit was supposed to be given to you from taking these meds, it wasn't ending the suicidal depression.
Right. And if they're not doing that, then what the hell are they doing, right? I mean, it's not exactly a glowing advertisement for their efficacy.
Yeah, yeah. Which is so often the case when people like Robert Whitaker write about it, the
Yeah.
anatomy of an epidemic,
Mm-hmm.
by a number of different measures. If these drugs are supposed to be helping and we have so many of them and they're being given to so many people, then why are the rates of people going on disability for mental health skyrocketing?
Mm-hmm.
Why are so many people more having to have them in this country and not other countries, et cetera? So there's really powerful
Yep.
questions to be asked. And a book like yours, I think, can really help people on that individual level and on the systemic level step into questioning this. So thank you for
Yep.
being willing to put it out there so honestly.
You're welcome. And it's interesting because the suicidal ideation really pretty much evaporated when I got the drugs out of my system. I mean, even in withdrawal, when it was just so hard to handle, the suicidal impulses disappeared. And I know I'm not the only person who has felt that shift. So it really brings into question, at least for a percentage of people, for me, like at what point do we maybe face the uncomfortable truth that at the end of the day, at least for some people, and we've done far more severe things in this world for far fewer people than this has affected, when do we start to acknowledge that maybe the drugs are actually part of causing the problem, or at least prolonging it? That's an individual question, I think, but for me, it's very clearly the truth.
Well, unfortunately, more and more people are coming through medical school and then finding books like Robert Whitaker's and others, and perhaps yours and Peter Bregan's, and saying, wait a minute, none of this was covered in medical school. And what if there's a whole different range of ways to help people with mental health struggles than just matching a list of symptoms with a list of medications?
Yeah, and I would actually really like to see a bifurcation of psychiatry. I think that we really need to treat never medicated people differently than we treat medicated people, because the assumption of the DSM is under the assumption that you are not influenced by a psychiatric drug. So if you have a spontaneous schizophrenic episode, then in theory you're supposed to follow the directions in the DSM or whatever and go down that route. That's a very different scenario than someone who's been on powerful psychiatric drugs, possibly multiple psychiatric drugs for 5, 10, 15 years, and then has some sort of break because a medication was changed, and now they're giving a diagnosis of schizophrenia and treat it as if it was a first time thing. Like it makes no sense to me. And I see so many issues as a direct result of polypharmacy, of people getting moved all over on their drugs, of being prescribed one drug on Monday and 2 Mondays later they're saying, oh, it's not working, let's give you something else. Like, these things create these psychological symptoms. So I would love to see, and I think that a lot of people want to put you in a box of, pro or anti anything, right? I think that realistically, these drugs aren't going away. So we need a lot more education and true expertise and specialists on how they actually work, what the different side effects are and manifestations in people. So if someone comes in and they say, hey, I was 17 years old and I was diagnosed as bipolar with depression and ADHD. I'm on one drug for each of these, and now I'm having these symptoms. I want a doctor to look at them and say, hey, you are on a ton of competing drugs. We need to figure out your genetic ability to metabolize these. We need to maybe get you off a couple of them and see if symptoms improve before they are immediately just, hospitalized and tranquilized even more. And that is a different practice than someone who is in a crisis for the first time, or they're having their first bout of, depression and anxiety, and maybe they're in a situation that's so extreme that everyone involved thinks they need a little bit of, psychopharmacological help. That is two different practices entirely, and yet there's no distinction, there's no nuance at all. And that's not even to say about, the 40-year-old woman whose both kids leave for the first time and she's feeling a little bit of empty nest syndrome, and so her OBGYN or her JP gives her some Paxil. That's a totally different problem too. But that's the point. The point is that this is extremely diverse, it's extremely nuanced, it's extremely representative of the individual who's involved and what happened to that individual, and yet we put these stupid blanket diagnoses and prescriptions on everyone and then walk around wondering, oh, we don't have any better solutions. And it's almost, why doesn't it work? It's not that hard. But no one wants to look at it because that takes time and effort and forces us to face some very uncomfortable truths.
Well, and it requires changing a paradigm in the way the medical field practices that. And, there's all kinds of dynamics and political reasons why that's challenging. But the most important relative to what we're talking about is the clinical impact on people. And so I just like the fact that a book like yours puts it out there for people that there is the option, that, there are more and more people. It's not a flood, it's not a tsunami yet of people who are studying this and willing to help you get off with a hyperbolic tapering or whatever, but it is an option. And you're just one of the many people who are experiencing that, but you're putting it out there in your story, so it makes it more available to people.
Yeah, as much as I generally don't really go through life with a cynical outlook, but I do have a fairly cynical view of the paradigm shift here. I don't think it's going to come from the top down. And I think if you wait for science to come around and solve this problem for you, you're going to be waiting a lot longer than you want. So therefore, this becomes an individual problem to be solved, both on the part of the individual and on the practitioner. It takes both. And so this is what's entirely frustrating to me, is that I get the paradigm and the system we're in, and it's profit driven, it's politically driven, it's okay, fine, we know that. But this is also not something that you don't have the power to change, address, and research on your own, whether or not you're a doctor or a patient. So the fact that we have psychiatrists and doctors who it's your job to be the expert and to go down the road of continuing education and to read a wide variety of research on this topic, and they don't, that frustrates me, because that influences the patient. And in the same vein, if you're a patient, it's kind of on you now to actually have some medical literacy and understand how research happens in this country, and what we know about these drugs that you might not see on the commercial. Like, you have to take your agency into your own hands a little bit, because you can't expect your doctor to do this. And even the most well-meaning doctors in the world, of which I think a lot of them actually are, they just have bad information, they don't have time because they're so bogged down with an absolutely crappy insurance system. So a big reason why they can't do their own research and stay up to date is because they're too busy trying to find codes in order to get paid to do their job. Like, the system's totally broken, but you can fix it for yourself within if you take a little bit of initiative, and that needs to happen on both ends.
Well, and that's the kind of thing we've been trying to promote with this podcast of psychiatrists like Dr. Jody Skillicorn, who got out of her medical degree and then read Anatomy of an Epidemic and said, oh my gosh, I've got to re-educate myself and figure out how to help people in a different way. And then she wrote the book Treating Depression Without Medication. And I think she's one of 6 or 8 different integrative and or functional medicine psychiatrists that we've interviewed just on this podcast alone in the past 2.5 years. So it's happening that people are waking up to it. But as you say, it's going to happen from the bottom up. It's not going to happen
Yeah.
that the system is going to change at the
Mm-mm.
insurance company level or at the medical school level.
Yeah, unfortunately, I want to speak to as many medical schools and as many residents as possible. I think that you got to plant this seed early. The most frustrating conversations I have are with people who've been doing this for a while and just kind of refuse. But when you get in the medical schools, you just get them earlier. And I don't
Yeah.
expect people to change careers. All I'm asking is that, hey, you need to know that psychiatric drug withdrawal and specifically antidepressant withdrawal is a very real thing. This is what it looks like. This is how you can avoid it. Here are the PET scans that show, the plasma levels and the CERT occupancy of each individual drug that will explain to you why you can't just say, hey, cut this pill in half for 2 weeks and then stop. Like, we have the research. It's not like I'm some, just conspiracy theorist here. I can show you the actual PET scans that were done for this drug and explain this. Why me, the chef, is the one having to do that is a baffling question. But here we are. And
Here
so I'm
you
going to
are.
do it.
And thank you for doing it. The other thing that I wanted to ask you about is, what do you think you learned most about or learned most from your year of travel, as through the fog of all of the extra intensity of the withdrawal in the first few months of
Yeah.
it? That was a fascinating part of your book. And you had such detail for the first couple stops. I thought, she's either going to, because we're running out of pages in the book, right?
Yeah.
She's either going to say, I dropped out and it didn't work out, or she's going to magically wrap this up. So what would you say you learned most from that year of travel?
Yeah. So, I mean, the real key part about the travel in my book is it's I often wish that when people reach out to me and, they're in their own withdrawal process, I wish that I could replicate the situation I was in for them. Because what it did for me is that the organization and the program I was doing, we traveled to a different place every month. So 1 month I was in Malaysia, and the next month I was in Thailand, and then Cambodia and Croatia, and so on and so forth. And what that did is it completely removes any external stimuli that you can blame for your own problems. So your environment's constantly changing. So you can't, in my case, I had spent so many years creating a narrative in my head that the source of my emotional distress was because of my business partner or living in New York or not having enough money or not, finding the dream partner or all of these things. There were so many reasons that I could look outside of me and point to and say, that's the problem. If I could just fix that, because I was in the same place doing the same thing. As soon as I started traveling and had absolutely, gotten rid of every single one of those external stimuli, and furthermore, that wasn't following me from place to place, because if I was upset about something in Malaysia, well, that was going to go away in 3 weeks when I was in Thailand. And shocker, there was something new. And so what you learn really quickly in that constantly changing environment is that the problem is you. And people don't like that, because especially for, emotional and mental health, it feels so outside of your control. It feels like something that's happening to you. But I looked at it and said, okay, if I'm taking myself with me wherever I go, I know that I have the power to figure out how to do this differently. And I was forced to, because the withdrawal symptoms were so bad that I was desperate enough to start trying new things. And as I started doing that, what we were really doing was kind of addressing all of this, kind of deep existential wounding. Then things started to get better, and I'm not as triggered anymore because I healed the issue, and so on and so forth. So it got to a point when I was writing where I was finally starting to feel well enough that it wasn't a book about traveling. It wasn't a travel memoir, so there was no need to keep writing. So that's why you didn't get the second half of that trip.
I think you did a beautiful job of explaining how it made sense then to just give quick summaries of the other
Yeah.
stops because
Yeah.
you had done such an integration of
Mm-hmm.
dealing with your new level of perception and getting through the withdrawal. And as you talked about, facing some fears, learning to scuba dive and doing it with all people that weren't your family that you grew up with. They weren't your best friends for years. As you said, the environment and the people kept changing, and yet you were able to make that progress. So I could kind of sense as you were writing that you were building that core strength that's so essential for all of us.
Exactly. Yeah.
That was really shaken to your core when you were 15 and you lost your dad. And then the meds got thrown on it. And
exactly. Yeah. I mean, I wasn't really given the opportunity to build tools of resilience when my father died, because I was medicated so quickly. So withdrawal was a crash course in that. And then even more so, I had to then kind of learn all the things that I think I would have learned more slowly in my 20s, but that I didn't learn because I was, living in a state of despair the whole time. And once I, got off the drugs and suddenly actually wanted a future, I wanted to live, then I had reason to gain some tools and to really get to know myself and understand the flow of emotion and intensity and the fleetingness of everything and how we're meant to change and grow and change our minds and, pay attention to how we feel around certain people or certain places or experiences. It's all of those things that if you listen to it, it's what really leads you to the life that you want. But if you ignore that, then you end up in a place you don't want. And
yeah. And the other thing is that during that period in your teens is when most of us from a relatively healthy family start to learn how to integrate the good stuff we're getting from mom and the good stuff we're getting from dad and the not so good stuff from mom and the not so good stuff from dad. And you didn't have a chance to do that because of the grief that wasn't processed and then the kind of this concrete shell around you that was formed by the dumbing of your senses, et cetera, from the medications.
Yeah.
How long has it been now since you've been off the meds?
Long enough that I'm sort of losing track. So I think we're approaching the 7-year anniversary. I believe I got off the last drug sometime in the summer, like August of 2016. So, and I was on a bunch of other prescription drugs too for physical stuff that had appeared within the year of being on antidepressants. So that's the other factor of this too,
Thyroid
right?
and stuff like that. Yeah.
Yeah. The antidepressants caused physical side effects that we then had to medicate with more pharmaceuticals. And so I didn't know up or down with my body. I mean, it wasn't just an emotional problem. It was my thyroid was a mess. I had something called bile reflux disease. I got off all of those drugs. I was just at a point where I said, I need to be really clear of everything and just see where I'm at. And I haven't taken a prescription drug now in 6 years. So no, the thyroid problem went away, which is miraculous. The bile reflux disease went away. Everything disappeared. Took a while for me to stabilize, like for my physical body to stabilize as well, but I just gave it time.
Are you noticing still little things that are still changing with the further you go away from the medications? I'm thinking
from a physical standpoint?
From the mental, emotional, physical, the whole thing. I'm thinking about Jill Bolte Taylor, who helped rewrite the ideas about what happens after stroke when, she was a neuroscientist herself who had her own stroke. And it used to be that they would tell you that most of what you recover after a stroke you get from, after 6 months. And if you haven't gotten it at the end of a year, it's not coming back. And she was rewriting that because she was documenting how things were coming back in her functioning 7 and 8 years after her stroke.
Yeah, these are just such crappy messages to give to people. I mean, I understand that, like, regardless of whether or not the research is sound, I understand, like, I love science. I love that we have science and research in order for us to give a general, umbrella of what might be happening. But it's the law of averages, and you can't apply averages to the individual. So to tell them, oh, you're not getting any feeling back after a year, God, it's cruel. It sets people up for failure. And so, yeah, for me, I mean, there are definitely still some things that I will never know, and often wonder if this would be different had I never been on the antidepressants. The like sexual health side effects, I really wonder about. There's PSSD, which is post-SSRI sexual dysfunction, that I know I experienced a level while I was medicated. And things have gotten better in the years since I haven't been medicated, but I still feel the only description is rather stunted in a way that I think had to do with the timing, because I was medicated right at puberty. And I think that has actually fundamentally altered that aspect of my life, which, it's something I wasn't comfortable enough to talk about when I was writing the books. It's not in there. It's something I've become more comfortable with the older I've gotten in, and I have seen improvement on that, but it's taken a lot of work and emotional work and, counseling work and forgiveness and grace. And so that's one aspect. I'm still dealing with gut health issues that I think were caused by the long-term use of all these psychiatric drugs. Well, all the drugs I was on, actually. Gut biome stuff. I mean, 90% of your serotonin is created in your gut, right? So if you're on an antidepressant, it's likely that that's affecting your gut somehow. So I'm looking at a stack of supplements over here that I'm working on to help just still get my digestion functioning in an unproblematic way. And then emotionally, what's interesting is that nothing I've experienced since withdrawal has been as bad as withdrawal, but sometimes you can get little snippets of sort of what I felt in withdrawal. Like if I'm feeling pretty emotionally dysregulated, or my nervous system is dysregulated, I am still very sensitive to noise. That was something that was a big problem in withdrawal for me, and I still feel that if I'm not kind of feeling emotionally strong, or if I haven't been taking care of myself. But now I just look at that and I say, okay, well, if you're having trouble being outside today because it's too loud, that probably means we need to adjust what's going on in our life, right? Like meditation needs to come back, probably need to call your counselor. Let's really look at what's going on, because something is breaking me down. So what this whole process did is it just allows my compass it's much more attuned. I can tell when I'm going off in the wrong direction far earlier than a crisis. And so then I can bring myself back. And it's beautiful. And that's what you learn. And I mean, God, if everybody had the tools I have and the ability to be as in tune with your inner state as I am, I don't think we would be where we're at from an emotional health level in this country, and even in the world. Like, but you have to learn it, and you have to have people who support you. And I got really lucky in the sense that my mom never believed I was mentally ill. So she was basically fighting against this the whole time. And so when I finally decided to listen to her, then I realized she was right the whole time. If you don't have that, if you have...
What was the first name of the counselor that she...
Alan.
Alan. Yeah. And that was another part of the book where I thought, well, you clearly got lucky with him as a coach and helping you tune into what's actually going on in your system, and not rationalizing all kinds of things about it, but being with it and letting it speak to you. That was just a beautiful piece of work. It's so in line with all the best stuff I've ever learned in 49 years of doing therapy.
I mean, when we try and use our brain to fix this stuff, I think we're going to reach a dead end every time, because so much of our mental and emotional health lives in our body, and our brains are just the little monkeys trying to make sense of it all. So we kind of got to get out of that.
Am I remembering this correctly? Did you say that your mother went and trained with Alan?
She did actually. So my parents had owned a family business together, and then after I went through withdrawal and had just had such a huge transformation, she said, "I'm not doing this anymore. I want to help people." And so she sold her business, and now she is in a second career where she works with people. A huge percentage of her clientele is either in withdrawal or recovering from long-term use of antidepressants. And so she works with them through multiple modalities now. So she uses the one similar to Alan, which is compassion key. She's also she uses a lot of hypnotherapy, and like, she's so good. And to watch her, to have her tell me, she'll tell me, oh, I have this client who, obviously it's all, I don't get details, but she'll just say, oh, I have a client who had this happen to them. They've been medicated since they were 9, and today they took their last, Paxil, and they're doing well, and it's been 20 years. I mean, you don't hear these kind of success stories from standard psychiatric practices, and it's the coolest thing, and I wish we could clone her a million times to help more people.
Yeah, I know the feeling. Occasionally I run into somebody that's just so good at that. Whatever they're doing, I wish we could have every therapist be that good, or every coach be that good. Well, I realize we're pushing up on one of my hard stops here because I have another patient coming in, but I wonder if you could just take a breath and get centered and let me ask you to think, is there something we've already talked about that you want to highlight, or something about your recovery or this book that you want to mention that we haven't even touched on yet?
I've been thinking a lot about kind of what the legacy of this work is and what I want people to walk away from. And I think I really want, obviously, more information and education about psychiatric drug withdrawal. But I think I would also like people my goal is to have people just start to question the stories they've told themselves around mental illness or psychiatric drugs as a concept, because we've really been sold a narrative, and we've been sold a narrative through advertising about what these things are. And so many of the stories I hear from people, they can always be traced back to a thing. Either it's something that happened to someone when they were a kid, or it's a series of bad things that happened to them, or in some cases, it's just years of being switched from one drug to another, and nobody puts 2 and 2 together that, hey, every time you switch a drug, you have a manic episode. Maybe it's the drugs. Like, I just think that we've really narrowed our view of this in a way that's hugely detrimental when it really needs to be expanded. The other thing that I think is really important, and that really needs to be demanded from patients, because it's not going to come from the top down again, is the idea of truly fully informed consent. I was on a call with a psychiatrist 2 days ago, and through a course of our conversation, he said out loud, he's very pro medication to start. He's extremely pro medication. And he goes, at one point he says, antidepressants are bad for you. They're poison. And then he just kind of threw up his hands and, basically said, but what other option do we have? And I wanted to ask him, and I didn't get a chance to, said, well, do you tell your patients that? Because in my view, that is part of full consent. If you told your patients, here's the reality, these drugs are bad for you, they are poison. They may also help you with this situation. Here's all of the information. What do you want to do with it? That is truly informed consent. That is true full consent, where the patient has the ability to look at all the pros and cons and then make the best choice for them. That doesn't happen, because I know he doesn't say that in his practice. Well, instead, he just pushes the positive.
That's right. But the other thing is, he said, what other choice do we have? There are all kinds of other options.
Right. Yeah, right? I mean,
Again, we don't have any other drugs, but we have other techniques and supports and structures. And
I agree. But even in a world where we're, where this is the last line of defense and not the first, that still needs to be said, and it especially needs to be said to parents for kids, because kids don't have any agency. When you're 15, you're not thinking about, when you're 15 and you haven't gone through puberty, you're not thinking about whether or not the antidepressant that your doctor and your mother and your father are about to give you is going to affect your sexual health for the rest of your life. That is not on your mind.
Right.
It's not your responsibility. That is the responsibility of the doctor and your parents or your caregiver or the social worker or whoever to know that and to be told that. And it doesn't happen. We don't have really informed consent. We have digital lawyer things that protect the doctor from getting sued. That is what consent means in this day and age, and it's bullshit.
Yeah, I would have to agree. And, that idea of more fully open, informed consent it would be a deal changer. I know, for a deal breaker for a lot of parents to hear, hey, this is a poison for your kids. And it might have these short-term benefits, but long-term, it's not a good thing to keep your kids on them, which is like the basic message from Robert Whitaker's book, Anatomy of an Epidemic, is that long-term, these things have more downsides than up. So,
and that also is reflected directly in the research. So it's not like anyone is trying to pull a wool over your eyes here. I mean, even Whitaker, well, I don't know. I know that in some of the, not Whitaker himself, but in some of the research Whitaker, talks about, and, all of these researchers, in some cases, sometimes there does seem to be short-term benefit, but it's rare. Short-term, we're talking 3 to 6 months, and there needs to be a plan to get people off. None of that is happening. So,
well, hopefully with books like yours and people like you to promote the conversations, we're heading in the right direction. And I thank you again for your willingness to share with our audience and for the courage it took to put this book out.
You're welcome. Thank you for having me. The book is available all around the world. You should be able to order it from any bookstore. It also, obviously, Amazon and all those retailers. And people can find me all over the internet at Brooke Siem. So that's BROOKESIEM. And I don't know, I respond. If people message me, I do respond eventually.
Well, I appreciate that, as well as your spending time with us today. It's been a pleasure. And thank you so much.
Thank you, Timothy.